Good morning, good afternoon, everyone. We will give a couple more minutes to allow people to join us for this webinar. So please stay tuned, bear with us. Thank you so much. Okay, so good morning and afternoon to all our guests and panelists. My name is Nora Quesada. I'm the Regional Director for Latin America and the Caribbean at JSI, and I will be moderating today's discussion along with my colleague, Anabela Sanchez. So before we start, I would like to cover some housekeeping. First, this session will be recorded and will be available afterward. Secondly, please submit all your questions using the Q&A function. And my colleague Anabela will also collect all the questions and we will address as many as possible during the audience discussion, and which is to follow directly after the panel discussion that we will have with our guest speakers. Thirdly, we appreciate if you can drop your name, location, and institution in the chat, so that we all know who we're connecting with. Lastly, we will keep the audience muted to minimize disruption during this webinar. And at the end, you will be able to ask all the questions that you wish. If we can go back a little bit to the slide where the list of the panelists who are joining us today are. So today we have the pleasure of welcoming Fillip Diaz, who is a logistics lead at PFSCM, Zahir Daniels, who is Merck's key account manager for PFSCM, and Cristina Ghiga, the head of client account management at PFSCM. PFSCM is a firm that has extensive experience in supply chain and procurement and distribution of health supplies across the world for different clients at the global level. Also, we wanted to mention that if we can go to the slide about BHA, please. So JSI is implementing the Building Capacity project to improve pharmaceutical and medical commodity management in humanitarian disaster settings program on behalf of the USAID Bureau for Humanitarian Assistance. JSI's mission is to equip humanitarian organizations and beneficiaries of the BHA program with guidance through activities like this webinar and other series of webinars that we have been working on and providing to the audience to help them better manage PMC management in humanitarian and disaster settings. The Partnership for Supply Chain Management, or PFSCM, which is a nonprofit procurement services agent and subsidiary of JSI, has been approached by JSI to share their health supply expertise and experiences with this audience today. PFSCM serves donors and governments and specializes in health products for COVID-19, HIV, malaria, tuberculosis, and more. More than 90% of their volumes are destined for Africa. One of PFSCM's long-standing freight forward partners, Merckx, is also joining this conversation to share valuable insights into how supply chain stakeholders can collaborate to expedite logistics processes in crisis. Merckx is, of course, a well-known, multifaceted global freight solution provider, and we are very pleased to have a representative with us today, as I mentioned, Zahir Daniels. So with me on the screen, you can see our panelists, Fillip Diaz, Zahir Daniels, and Cristina Ghiga. So welcome to all of you. As I said before, Fillip is a logistics lead with PFSCM. Zahir Daniels is Merck's key account manager for PFSCM, and Cristina Ghiga is the head of client account management at PFSCM. This group of individuals today brings a wealth of specialized health logistics and supply chain knowledge, and we look forward to diving into the discussion. But before we do so, we would like the audience to answer a quick poll question related to this topic. If you can please choose any of the answers that appear there on the screen. Okay, we can see several responses related to communication to communicate more effectively, and the source locally to reduce reliance on global sources. Okay, so we can see that a lot of you think that both communicate more effectively and try to source locally to reduce reliance on global resources can contribute to reduce lead times in supply chain. So thank you so much for your responses. And so this is very helpful in that will help us start with the and continue with the presentation. So now that we have, I would like to start this conversation with the key themes that we're going to be looking at today. The first one is how the end-to-end supply chain management works from the point of view of PFSCM based on their experience. Also, how lead times and how to optimize lead times throughout the supply chain management cycle. And also the role of the suppliers and freight forwarders to optimize the procurement and the delivery process. It is very important to remember that since we're talking about the end-to-end supply chain management, both suppliers and recipients have a role to play in reducing or optimizing lead times during the delivery process, especially when trying to reach the last mile. So I would like to start by asking the first question, as probably I mentioned before, that this will be a conversation that we will have with our panelists. And after this conversation, you will, of course, engage with a conversation at the same time with our panelists today. But in order to initiate the conversation, I would like to start by asking Fillip that from PFFCM's perspective as a PSA, Fillip, can you briefly explain the main steps or processes that you as PFSCM are usually involved in the health supply chain from placing the order to receiving the goods?
Thank you, Nora. Good morning, good afternoon, or good evening, depending on where you are in the world. Yeah, from our perspective as a PSA, the very first step in our health supply chain execution is forecasting and demand planning that is done by the recipient countries or by the donor. So the donor or the recipient countries, they're expected to have this forecasting and effective planning submitted to us timely and accurately, because that will allow us, the PSAs, to work towards the delivery date that is requested by the recipient countries. Of course, taking into consideration the production lead time that we get from the suppliers and also the transit lead times. So the orders are placed with us, the PSA, by the recipient or directly. Sometimes the order placement can also be done through the donor's system via the internet, for example. And then we will first evaluate the order and address any specification or concerns that we have with the recipient. It can be anything related to the item that was requested itself, if there are specific technical specifications of the item that need to be clarified, and things like that. So the order is then confirmed after we clarify all those burning questions. And if a price quote is then accepted by the recipient, and the price quote might, of course, include the freight estimation for the delivery of those items, then a purchase order is placed by us with a specific supplier, provided that the supplier has offered us a suitable price and that the products are actually pre-qualified by, for example, WHO. Yeah, we also may try to find new sources of supply through competitive bidding processes. So then we will send over a tender request to certain suppliers. And then in addition to that, product quality assurance also might take place before we confirm the order. And it depends on a few factors. For example, if the product is being sourced for the first time or not. Then we need to do this additional quality checks before. And then the order is sent over to the supplier, and then the process moves then from order to order fulfillment, which will involve then the logistics arrangements afterwards. The advent of COVID-19 actually, brought to us the realization that a lot of production delays started happening, right, as a result. And it really negatively impacted our operations, and delivery on time was something that we really struggled with for a while. And then we had to liaise with the recipients and start engaging with them proactively in communicating to them that there was a production delay. So that was one strategy that we really needed to work very closely with the recipient countries, because we started hearing a lot about stockout situations and the HIV testing programs, malaria testing programs, they needed to be halted because simply there wasn't any product that was available to attend the demand that was happening. And then we would try to conciliate a little bit of the consumption rates from those recipients together with the stock that they had available, together with also what the suppliers had at hand to provide to us, considering also, that the production chains, they were broken. The lockdowns, a lot of factories, they were closed down for a while. So we really had to work off the stock that was available instead of working with the production that was scheduled for the future. In a happy flow, when we talk about a happy logistics flow, the logistics process, it will entail allocating a shipment to a freight forwarder based on the product specifications. So to give you an example, we have forwarders that are specialized in shipping cold chain products or chemical reagents, analyzers that need to be kept frozen throughout the whole transportation. So we'll take those technical aspects of the product in mind before we allocate them to a specific freight forwarder. And the freight forwarders, they're also selected based on performance and price. We usually tender the prices every quarter, so that we have that already and we don't need to do a tender on every shipment. Otherwise, I'll delay the process considerably. And also, we take into account their experience in specific shipping lanes. And then once the shipping documents are produced by the suppliers, we then share them with the freight forwarder and ask them to book the transportation from point A to point B. Another essential component that usually comes into play prior to picking up anything from the supplier's warehouse and then delivering it to the recipient countries is what we commonly call a waiver. Waiver is a generic word that we use here, but it means anything that is required by the recipient countries to admit any goods into the country. It can be an import duty waiver, it can be an import authorization document, it can be a registration waiver from the National Drug Regulatory Agency, for example. And through a network of local agents placed in those countries and our freight forwarders, we support our recipients to identify what exactly is needed before the goods are shipped. And we make sure that all this paperwork is ready before we actually ship anything. And then once that's done, we start arranging the shipments, and then our freight forwarders that will directly communicate with the recipients the estimated date of arrival. They will send off something that we call the pre-alert, which is basically an email which will contain all the shipping documents related to the particular order and the estimated time of arrival. And in that email chain, there will be communication exchanges about the customs clearance process in the country, and then we might involve the recipient if we face any challenges with the customs, and then we sort it out until the goods are finally delivered. So as you could hear, there's the execution of an order all the way to the delivery. It takes a lot of time. A lot of stakeholders are involved in that process, and having that connection between all the stakeholders is really important, and communication really plays a very, very important role here.
Wow, thank you so much, Fillip, for giving us an overview of what the process is all about, and the importance of taking into account that many stakeholders have a role and play a role in this process, and that it's very important to take into account as well that forecasting and demand are two important steps within this process that you just described, as well as understanding what procedures need to take place at the country level or from the recipient side, which is sometimes the registration waivers that are also play a key role in humanitarian settings, because sometimes you need to bring in the products that you need in very quickly into the country. And so understanding the importance of several procedures there, including the waivers, is really key. So thank you so much for giving us an overview, a very thorough overview of the processes. So I would like to ask Cristina now, based on your experience, Cristina, and in the current global health environment, what steps or links in the supply chain actually result in the longest lead times, and why?
Thank you, Nora. Good afternoon, good morning, everybody. Never in the past we have witnessed such a level of volatility and unpredictability in the supply chain management execution, and as we've seen since COVID, right, since the pandemic. We have observed shortages in essential medicines. Some products needed to fight COVID-19 were the same products used to treat, either to treat or to diagnose HIV, malaria, or TB. The demand for these products, and we can think just of some examples like the deep well plates, lopinavir or ritonavir, increased and the production started taking strain, resulting in longer production lead times, right? So one was manufacturing, the gap between the demand, the supply and the demand. The processes for obtaining waivers and tax exemptions, as Fillip has already highlighted in earlier, in many LMICs remain very complex and lack transparency. Often the reason they are the reason for considerable delays in delivery. While the need for the simplification and regional alignment of the local requirements has been unanimously recognized, we don't see yet improvement in this direction. So each country has their specific processes, specific requirements, which makes it very challenging for the supply chain stakeholders to complete. Next to processes, the human resources are also a very important element of the equation. Often in country supply chain staff either lack expertise, and they do not have a solid understanding of the logistics processes, or in some cases are not empowered to act or to make decisions. The length and sometimes even the lack of clarity of the decision chain also adds to the product lead time. Of course, during the pandemic, we've seen that the lack of shipping space, both on air and ocean mode, resulted in long and sometimes even unpredictable transit times, right? So we all witness that. But all of the above are market development where we have little control or to no control. And until now, PSAs, program implementers, forwarders, and 3PLs have addressed to their ability every challenge in the supply chain execution, and they managed to limit their impact on the total product delivery. But if we are thinking further, is there another step or another area in the supply chain that was not looked into, where we can exercise more control? And in my opinion, there is one, that's the procurement planning. What we see now is that on one hand, the procurement plan plans are usually based on the happy scenario. They are not including risk mitigation, they are not including buffers, right? On the other hand, lacking procurement policies and well-defined planning and procurement processes, plus lacking pre-qualified suppliers for the essential health products are main barriers in issuing feasible procurement plans within tight timelines. The procurement process is often lengthy, unstructured, far from optimal, and what is very important and very painful, in my opinion, is that it doesn't take into consideration the latest market developments. So many of you have responses that communication is very important, and yes. So the people who are responsible for the procurement planning, they are very aware of the medical, the clinical data, the products which are available, but they do not have that market insight that the other stakeholders in the supply chain have, right? So I'm talking about both the supply, right? Changing in supply, challenges with the manufacturer, with the suppliers, as well on the freight side on our partners like Maersk, like PS, and all the others. Ineffective and late procurement planning does not allow flexibility in execution of the procurement plan. So every delay which is coming in from not correct or not effective procurement planning is having a cost down in the supply chain, in the delivery, right, in the order execution and delivery. And that's why I suggest as the next step for us, for the supply chain professionals, is to look into the procurement planning to make sure that we mitigate risks at the planning phase instead of down the chain.
Great. Oh, thank you so much, Cristina. You gave us I would say key points to think about. One of them is the importance of having skilled or trained human resources, which is very important. If you don't have the human resources that the organization needs to handle this type of situations, or know how to implement a procurement process, it would be very difficult to respond to, especially to crisis. You also mentioned the need to have procurement plans in order to mitigate the risks, and also the need to have buffer stocks within these procurement plans. And of course, the fact that the importance of having pre-qualified suppliers to make sure that there won't be any delays in identifying these the key suppliers to procure from these health supplies, which is also key to reducing lead times. So let me go back to Fillip. And Fillip, so Cristina was mentioning very important things about procurement planning and how to reduce, how to mitigate risks, especially in humanitarian settings. Can you go back to the previous slide, please? So in a crisis situation, Fillip, orders and shipments often need to be expedited, as we know. How can stakeholders really help speed up orders and shipments, and especially in the areas that traditionally take the longest? Because we were talking about, when you have unpredicted situations like the COVID-19, it was unpredicted. Nobody knew what was going to happen. So how can stakeholders really help speed up the processes in these cases?
Yeah, thank you, Nora. Actually, during the COVID pandemic, we actually learned a lot about this, and it really helped us to shorten the lead times in areas where the lead time was really impacting negatively our response to crisis situations. We noticed, for example, on the procurement side, securing licenses to produce COVID-19 diagnostics was actually quite quick. So once those test kits were available, many suppliers, they decided to shift their production from key diseases like HIV and malaria to focus completely on COVID-19 to attend to that increased demand on diagnostic test kits. So it meant that certain diseases, they had to suffer a little bit so that the COVID response was more effective at that time. Another example that we worked with here, also related to the procurement process, was to redesign the order placement process. The order placement process can be quite lengthy because it involves many stakeholders, right? The suppliers, the recipient, the donor, us as the PSA. And in order to mitigate that and make sure that we were able to move faster towards order fulfillment, we came up with the order placement process that had a much faster turnaround. So we looked into how we can, in the approval chain, before the order is ready for the supplier to work on, how can we here internally, also together with the donor and the recipients, cut some of the times that were really eating up the hourly time? And so we agreed on certain key things that were really necessary for us to understand what we need to procure a certain item to fulfill a certain order. And we were able to cut the order placement process in a way that we were able to actually get the process moving within the same day. So let's say a recipient in a country A or B sends us a request to procure to them COVID-19 diagnostic test kits. that request was actually approved within a couple of hours only.
Mm.
So that allowed us as a PSA to really start the conversation with the suppliers and see what was available, when we can receive the shipping documents and send them over to the recipients for them to apply for any import permit that might be necessary. And so cutting a little bit of the bureaucracy and see what actually here is essential in terms of quality, for example, that's a component that's really important. We can keep, and what other aspects we can then remove from the process to make sure that the things can move a little bit faster. So that was really, really, really helpful. And actually, it was implemented for COVID, but it was so efficient that then we decided to keep that process ongoing for other key diseases as well, so that we don't need to delay our product procurement process. And then on the logistics side, we identified that the waivers that we talked about a bit earlier can also be obtained much faster in a crisis situation. To give you an example, again, related to COVID-19, since it was a new disease, a new commodity that was available for the recipient countries to procure, many governments, initially, they were a bit hesitant and they were like, yeah, I need a registration first at the drug authority before you can import anything here. Or they will also ask for a duty waiver to make sure that the recipients would not pay for any taxes. But they didn't have time to really deal with all this bureaucracy, right? I mean, COVID was really an emergency situation, and they needed to tackle those issues in a way that would allow the recipients in those countries to receive the goods much faster. So one example that I can point out here for one of our recipient countries that for what they did was that they tried to work with the local authorities to have those permits issued on a master list. What that meant was they made a forecast of how many COVID-19 test kits they would need for a given period of time, and then they'll issue a permit that was valid, for example, for 6 months or for a year, depending on the need for that country. What that meant for us is that we were just allowed to ship things straight away because the permits were already issued. We didn't need to apply for a permit with the Ministry of Finance or with the Ministry of Health for each and every single purchase order. That really cut down the delivery lead time a lot, because the waiver process, depending on the country, can be quite lengthy, right? We need to go through multiple approval levels within the local government to get those approvals in place. So yeah, those strategies, they were very successful. And like I said, we seeing that they actually work, and they cut the delivery lead time in a lot. Many of those recipients and also the governments, they were interested in applying those strategies to a broader scope, not only to COVID-19 items, but also to other diseases that they also work with. And then, yeah, they just saw that it was in their best interest to also change their policy. And now we see that for other diseases, we're able to also deliver in a much faster lead time, because they saw that it worked. So, yeah.
Great. Yeah, so you mentioned two key things, Fillip. One was that in the way you reduced the lead times in those processes that you had influence on was the order placement process, as well as the waivers and permits. Getting these permits for a longer time helped introduce the products in the countries. Also, one of the things that people usually at the country level say that could help reduce lead times is sourcing locally, but sometimes there are no local suppliers. So the waivers and permits are very important to process, because some of the products are not available from local sources. So you touch on two very key points again. So moving back to Cristina. Cristina, can you give us a real life example of how standard supply chain activities like procurement and logistics have been altered or changed before in response to a unique crisis, probably in the case of COVID or any other crisis that you can think of or you have experienced in?
Sure. Thank you very much, Nora. I think that an example that comes to my mind is Pakistan. We have been serving Pakistan since 2010 on ongoing basis. And in 2019, 2021, and 2022, we had opportunities to assist the country with emergency orders for HIV and malaria testing and treatment products. So also during COVID, right, when the HIV and malaria products were already short on the market and supply, we had urgent orders for one of the most challenging from logistic point of view country. In the first 6 months of 2022, despite Pakistan's trade restriction for imports from India, next to this product delays and reefer container shortages, we were able to assist the Directorate of Malaria Control in the country with large and urgent deliveries of MRGTs. The recent urgent deliveries to Pakistan consisted of 14 reefer containers, adding to 95 metric tons delivered by ocean and other 11 tons of MRGTs delivered by air cargo. So in total, we had to deliver under emergency conditions 106 metric tons. Expediting the procurement and the shipping required extensive coordination with the suppliers and 3PLs. And I was happy to see in the poll that most of the participants evaluated communication, right? Communication with the stakeholders in the supply chain critical for the success of our mission. To prevent possible stockout situation in Pakistan, we advocated for shorter production and documentation approval lead times. So we approached the manufacturers, we looked at the approvals, but we also speeded the delivery using the first and most suitable available freight options available. PFSCM is in a favorized position, having many years of experience in this regard, and with very, very challenging countries and complex settings. We are well positioned to negotiate and to collaborate with suppliers and shippers to ensure service continuity, even in unique or in crisis circumstances. My conclusion here is that choosing the right partners when responding to an emergency is also very, very important. Meanwhile, COVID is still affecting the supply chains, and when we work on the above-mentioned order from 21-22, we and all the other stakeholders in the chain were experiencing the knock-off effect of the pandemic. But we managed to work closely with our suppliers and to prioritize the production and the delivery. The supplier was able to reduce the lead time for the first urgent order to about 50 days, which is 25 to 50 days improvement on the standard 75 to 90 days standard manufacturing lead times, which is, if you look, so it's incredible improvement. And further, we collaborated closely with our 3PLs to overcome some unique logistical barriers which occurred during planning of the ocean shipment. As we know, urgent deliveries to Pakistan are not only complicated by the trade restrictions imposed on imports from India, but also by the global shortage of reefer containers. By recognizing these issues early communicating with our partners, engaging them in finding a solutions, we managed to have an excellent response, which was very well recognized by our customers.
Great.
Thank you.
Yeah, thank you so much, Cristina. I think that one of the key points you mentioned was to build this trusting relationship between the manufacturers, the PSA, the recipients, and so forth. Again, communicating effectively, it's another key aspect of the whole process, and that at the end of the day, it could impact the reduction in lead times, which is in a positive way. So last but not least, I would like to ask the following question to Zahir. So Zahir, from Merck's perspective as a freight forwarder, what steps in the logistics process are most vulnerable to disruption in the event of a crisis, especially because, as you know, we're talking about here to humanitarian organizations. And how can these steps be improved or executed differently?
Hi, good morning, good afternoon, and good evening, everybody. I hope that you can benefit from my answer, and it's not an exact science, but I'll try and answer the question. I think supply chains is obviously very highly interconnected, and one process inevitably impacts the next process. So I would say all steps are equally important, and then obviously all steps in the supply chain are equally susceptible as well as vulnerable to disruption. But I mean, if you look at what happened in COVID, from our experience in COVID, the lockdown caused a lot of disruptions and changes, but especially if you look at when a region was under lockdown or a port was under lockdown, and then with the lockdowns, the associated restrictions on travel as well, you then have the lack of labor availability during those times, resulting then in containers and ships being stuck in ports, the turnaround time on containers not being fast enough, being able to reposition containers and making sure that your vessels get in and out of port was obviously challenging and then not that easy. Also, from our perspective as Maersk, when it comes to our physical assets, such as the containers and the vessels, making sure that, like I said, the containers and the ships are available in different key locations so that we can also make sure that we create buffer or reserve, stock in case of disruption in any area. But obviously, we also had to be creative, extra creative, I think, around these issues. We had to make sure that the supply chain wasn't further disrupted. So working with the likes of PFSCM and all the stakeholders to make sure that we have the right equipment in the right locations, so that we can ensure continuity for our clients as well. And I think having the availability of the right equipment, such as reefers, such as dry containers as well, in these diverse locations, we were impacted. I think that's a very, very important thing to have, as well as even building better relationship with all the stakeholders. And what we've seen is we basically formed a lot more partnerships during this time because we all had to work together to the best of our ability. So the partnerships definitely came in handy, and we definitely improved on things as we went along. I think import and export documentation is also very important. We all know that there's waiver processes involved as well, and that can also be susceptible and is also a bit vulnerable, during these COVID situations, especially in the crisis situations. Sometimes we had certain offices where there was a lack of human resources due to the lockdown, whether it was the Maersk office, whether it was a local office where we needed help with from a waiver perspective. All these things that we took into consideration was very important. But again, I think having the right resources in the right places, focusing on the specialization as well, such as documentation, and then pulling it all together, I think really did help, and it sped certain processes up that you normally wouldn't see because our backs were against the wall, and our main concern was making sure that we get the products to where it is needed. Eventually, I'd like to believe that if we get to a place of faster documentation as well, processing, more automation, and working amongst the respective stakeholders, I think we will see faster processes. Hopefully, we can have blanket waivers in place as well, which will also lead to faster movement and execution. And yeah, like I said, when we all collaborated and we all worked together because we had to, you know, we depended on each other, we saw that we're capable of doing amazing work. And we all came together. But also, I think in an ideal situation, we would like to have slightly better forecasting. I know we're dealing with crisis situations, which doesn't always allow for this, but should we have the available practice of good forecasting, it just helps us as Maersk owning the vessels and the equipment, being able to have it in the right place at the right time, reducing lead times, reducing wait times, making sure that we can deliver the goods to the supplier for them to pack, as well as to the specific destination country to get it delivered faster. That will definitely make a difference in shorter lead times and faster deliveries.
Great, thank you so much. Here you mentioned very key things like the importance of labeling correctly, having buffer stocks, having the right equipment, the import-export documentation, and also collaboration. Again, collaboration that has to do with effective communication across throughout the process. So this is a nice way to end this conversation with you. And now, without further ado, I really appreciate, thanks so much, Fillip, Cristina, and Zahir for answering all these questions. But there are more questions from the audience who have been bombarding us with different interesting questions. And I'm sure this guided question that you just responded provided our audience with enough context and ideas to stimulate this further discussion that we're about to start. So I'll pass on the baton to my colleague, Annabella, to help us, address some of the questions that have been coming in from the audience. So Annabella, the floor is yours.
Thank you, Nora. And thank you, everybody, for your questions. We would like to start with a question from Oscar Valderrama. I think this question is to Fillip. Do you have a standard timeline to the process that you showed on the screen? Depends, or does it depend on any procurement threshold?
Thank you, Annabella. We do have standard lead time for both the procurement process and also for the logistics side of things. With certain suppliers with which we have contracts in place, we try to get from them the production lead time every now and then, so that we can align that with what we have in the pipeline. And that will allow us to, when we are submitting the quotation back to the recipients, to tell them what is the most exact possible delivery target. And similarly to the logistics side, we have standard lead times in place for example, how long does it take for flights to get from New York to Lusaka in Zambia? We have those things recorded. Same also for the ocean freight side of things. We also have standard lead times for customs clearance processes in the destination countries. So we try to know beforehand how long it might take for an authority in a recipient country to actually release the goods to be delivered at a given warehouse. And so those standard lead times, they're really helpful for us to give to the recipient a realistic estimated time of delivery. And then, of course, when there is a crisis situation and things don't work as per those standard lead times, we also try to engage with them early in the process to communicate about any possible delays and also to come up with strategies to mitigate those possible delays.
Thank you, Fillip. And you're mentioning very important key themes like communicating early in the process, right? That's Absolutely. Part of the planning. Mm-hmm. Yes. Thank you, Fillip. Another question for you is from Joseph Yesha. What Fillip has explained is an ideal situation. How do they handle an emergency situation where you may not have the luxury of forecasting and demand management, Fillip?
Yeah, it's a bit challenging. I understand from many of the recipient countries that we work with, this proves to be, in some cases, one of the most challenging parts of the process, which is really to get us the forecast for a given period of time. And we understand that it's not always possible, but we, like I said, we have contracts in place with different suppliers, and those contracts, they really help us attend to any demand from any given recipient as needed. So you will submit your purchase order to us, the PSA, either directly or via a given system. And then we will try to liaise with the suppliers based on the date that you would like to receive the goods. And yeah, the contracts, they really help us with the suppliers specifically to attend to those requests where the forecast was not made in advance. In some cases also, we see that the requested delivery dates are far ahead in the future, which then allow us to align the delivery date a little bit better. But if it is something that it's really urgent, another strategy that we try to use here is to check with all the wallet of customers that we have. If a certain recipient has a stockout situation or an emergency situation to be attended to, and another customer who placed an order a bit earlier, and we promised to them that we're going to deliver their order at the time that they requested, if we know that it's not something that is going to affect their stockout or their utilization rates, and it will not affect the program, we do not stop the program in any shape or form, we can always make those shifts as well to make sure that every country has their programs up and running without any interruptions.
Thank you, Fillip. It sounds like you keep very busy, tackling all these priorities so that you don't affect the availability of the products of all the customers that you serve. Thank you, Fillip. Mumin Yaro, thank you for your questions. This is also for Fillip. Based on your experience, where do bottlenecks and delays reside? Which steps in this process are lengthy? And what did you do to reduce lead times? Do you communicate in this process with program managers, or are you communicating with supply chain officers or managers?
The communication part, we try to involve as many representatives from a certain recipient as possible. Depending on the situation, for example, if you need to talk about waiver processes and import permits and registration permits and this sort of things, we might talk to a supply chain officer, but it's also the discretion of that country, of that recipient, to decide who should be involved in that communication. If we have an escalation point where we think that that person might be able to expedite the process, we might involve that person. But sometimes the supply chain officer has the ability to liaise communication internally in the country to solve a certain problem. So we try to leave that at the discretion of the recipient, but also we try to use our expertise in dealing with that recipient along the years to see how those emergency situations can be resolved. And then speaking from my side, when we talk about logistics, I think that the most critical bottleneck that we face here on a daily basis are really around the authorizations to import goods. So talking about import permits, like I said, or also registration waivers or import duty waivers, every country works in a different way, and we try to make sure that we are aware of those requirements, and if anything changes along the way, that we also take them into account. And we have agents on the ground who actually support us with getting those authorizations a bit faster. But since we're talking about government bodies, and sometimes more than one, sometimes 2, 3, or even 4 different bodies that need to actually issue those authorizations, it can certainly delay the delivery and increase the lead time a lot. And then, yeah, during COVID, what we experienced as well at one point, as Ahi mentioned earlier, was about the human resources, right? You have lockdowns in place, you have people who are sick, and all this added up to the lead time for those authorizations to be in place. But yeah, those strategies, they really are helpful. So like having someone on the ground who can actually push the authorities for issuing those permits a little bit faster, or like Saeed mentioned, a blanket waiver, which means that you have a document that is valid for an extended period of time, and then you don't need to wait for that on a case-by-case basis, would be really, really, really helpful.
Thank you, Fillip. Yes, that bottleneck of knowing the processes of importation are very key. Thank you for your comprehensive response. We have a question from Emanuela Tombe. She says, what can be done when making procurement of integrated project for essential healthcare system where you procure a long list of different items from pre-qualified suppliers? How can you handle that? She says this question is for Fillip, but if there is anybody else from the panelists that may respond, please go ahead.
Yeah, Cristina, would you like to
Sorry,
yes.
I couldn't. I was not able to raise my hand virtually. Sorry for this. So, Emanuela, thank you for your question. If I understand right, you are looking at programs which involve a wide category of products, right? So they're all integrated and they come from different suppliers. Is that correct? So we are supporting our customers. Normally we are supporting programs, right? So when in one program we can have medicines, we can have diagnostics, we can have lab, we can medical devices, and everything is for one customer for one procurement plan. So we are communicating, we are collaborating with the customer to understand the needs, what is desired, what are the timelines, and what are the preferences, right? And then we work on the other side with the suppliers, with the manufacturers, or with the wholesalers to understand the availability and the location of those products, and we optimize the execution of the procurement plan. So when we can combine, we combine orders. We will make use to make the freight more efficient, more cost effective, right? We will minimize the number of shipments where possible, and how can I say, the moments when we touch the cargo and we move the cargo. So this is how we are approaching. Also, if we have different suppliers in different regions, we are looking which is closer to the demand, or which makes sense to be combined with another product coming from the same country or region. So we do first analyze the requirements, and then we come with a plan. And sometimes we need the customer approval to proceed in a certain way with a certain supplier, right? Or when we have that agreement with a client, we proceed with the execution. I hope that this answers to your question. Otherwise, please write me and I will try to elaborate more. Thank you.
Thank you, Cristina. And we have several questions, but we are looking at the watch and we will be writing all the answers of all the questions during the session, and we will share with you together with the PowerPoint presentation after these sessions. So thank you very much. And I will pass the floor back to Nora.
Thank you, Annabella. And well, we knew that the time wasn't going to be enough to respond to all questions, but we will get back to you. But before we close, we would like to share some ideas for action. For example, We heard Fillip and others talking about forecasting and demand, and how forecasting and effective demand planning play a key role in reducing lead times. Also, shorter order placement processes for health can help reduce lead times, as well as other themes that were mentioned, like order fulfillment process, waivers and permits, to have them in place and to know how to do that, especially when you don't have local suppliers to fulfill orders, especially during crisis. And also the faster documentation processing, which is very important to know, and having the right human resources or the skilled, the trained human resources to understand how the process works and how to reduce lead times as well. Also, one of the things that the team suggests, if we want to respond effectively to crisis in health supply chain, the stakeholders need to build flexibility into the processes to fast track key activities, as we heard. Sometimes, having a list of pre-qualified suppliers is very important. The effective communication is important as well. Try to be proactive about it, and to know who to talk to at the right level and the right time. And also, very important, to partner with key organizations that have the expertise and resilience to succeed despite tough conditions like crisis. So these are the takeaway messages. With that, we would like to thank everyone for your time and participation. And as mentioned, this webinar has been recorded and will be made available to the participants of this call. And also, we want to thank BHA for its sponsorship to hold this series of education webinars. We're also sharing some resources that you can see on the screen, and they will be available once you receive a copy of the PowerPoint presentation, along with the responses to the questions that we were not able to address during this webinar. So thank you so much. Have a good day, good afternoon, and keep well, and see you next time. Bye.
Thank you, Nora. Thank you, everybody. Goodbye.
Bye-bye.
Bye.